Hi, this is Ian Wright, the osteopath, and I'm just kind of continuing my occasional series on holistic thinking in clinical practice. And today I think I'll just talk about something very simple in terms of a sports injury, a chronic, say, hamstring tendonitis. The biceps femoris at the back of the leg is too tight. Let's say this is a sportsman who has this injury and has had it for some months, and it's put them out of playing active sports, say they're a county hurler or something, and keep going back to physio, which helps a lot, opens it up, works on that tendon, releases it. But every time they go out and they go into full power when they're exercising, it shuts down again and they're not getting better. Now, I've seen this hundreds and hundreds and hundreds of times in practice, and there's a variety of causes for it. So as with everything, and what I'm always talking about, you can look at the local area, but you have to look at the whole as a functional unit of a person. And there's lots of different factors that can be involved. But here we can look pretty biomechanically, very simply. I mean, there's a million causes why this particular hamstring injury remains. And I mean, let's take, for example, they've had a twisted ankle and inversion strain of the lateral collateral ligament, the lateral side of the ankle. They've twisted over their foot, playing sport a couple of months before, right? And that hasn't really been sorted out. That injury to that ankle hasn't been sorted out. This is just an example, and there's millions of different examples of how this can happen. So what happens, though, in some of those unresolved inversion strains, those ankle strains, the fibula, the lateral bone of the lower leg, can actually sit slightly downwards. It can stay in this kind of inversion. You can see it. The foot kind of tends to kind of invert, and it kind of drops down laterally, and it's just kind of stuck in that slightly altered position if you look closely, and that hasn't been resolved. Say that happens. What happens with that is it puts your weight bearing of your foot laterally down onto the lateral side of the foot. And so what does that do? That tightens up the hamstring at the back because it's pulling the hip slightly laterally, and that tightens up to try and keep it in line. So already you've got this structural kind of imbalance. It's like when your tires aren't balanced, they wear out slightly differently. And so this is an example of that. So you're putting naturally, in your natural position, you're putting more strain and tightening up the hamstring. So you're prone, when you're using it hard, as a sports person, these fine balances and these fine imbalances are so important because they can be the difference between being injured or not. So you have to have a structural balance inherent right the way through the body. I mean, another classic cause of it would be something like, say, a fall or an injury onto the right-hand side. Say it's a right hamstring problem, a fall onto the right hip pelvis, a few months previously. What that can do, a traumatic kind of fall pattern, can actually put a little bit of a rotational axis through the whole pelvis. And the pelvis can actually sit backwards. And so what it can make it look like is that there's a shorter leg. If you've got someone lying down, that the leg actually is shorter on that side. But what's happened is actually the pelvis is locked backwards on that side. And that just contracts all of the muscles in that leg. Now, what's that going to do? Well, that's going to tighten up the hamstring. And so the hamstring's going to be tight, and you're going to be running or walking around with an imbalance in your muscle groups, front to back, because of that imbalance. And that is one of the most common causes for chronic hamstring problems. And if you get the structural pelvis aligned, it can heal. And the problem with them is they don't heal if the alignment's not correct. Or say you've got a problem with a strain of the posterior cruciate of the knee, and that's structurally imbalancing the knee anterior to posterior. So the muscles get recruited to tighten up, to try and protect the imbalance in the structure. Or another classic cause of a hamstring is the psoas muscle, which is a deep postural muscle. It's a hip flexor, but it comes right up through the iliacus, through to the pelvis, onto the lower ribs. And this postural muscle can often become too tight. if we do too many abdominal crunches with our legs down or something like that. And if it's too tight, it can rotate the pelvis. So it kind of tightens up. It can actually rotate the pelvis in the wrong kind of direction and puts you into a kind of arched lumbar spine. What that does, of course, is tighten up the muscles in the psoas. So your front to back balance of muscles are gone. And that, again, can tighten up the hamstring naturally. So we have to look at all of these kind of structural considerations, and there are ones further up the body in terms of the spinal and the neck mechanics. We can go on about this forever. But I think you're getting my point, that you have to look for some local injury that isn't resolving itself. You have to look at the whole person. And also there are other factors which we've talked about previously, like why is this tendon constantly in a state of inflammation? Is there something in the diet or something in the lifestyle that's actually making this chronic inflammatory localized change in the body? And maybe we can adjust some things in terms of inflammatory foods or whatever in the diet that can actually help it heal, because these things actually have to heal properly, but you need a healthy environment to heal, and the structure has to be aligned. Especially, most of us can get away with subtle structural malalignments, but people on the top level of sports, subtle differences cause big problems, and it's highly refined. It's like a racing car. Subtle imbalances cause big problems, and we have to look for these real subtleties, and that's part of the kind of the fun of it, is trying to work out what parts are causing this, where is the key point, and it's normally nowhere near the actual symptom that's actually causing that structural imbalance. Anyway, just a little introduction to that massive subject. I wish you well.